Rightio, I'm off to have my iron transfusion, and all this talk about numbers gets me to thinking how special I am medically, and how all the really rare, well not all, but some of the really unique rare things for me and my age and my demographic do tend to happen to me. So after I get my iron transfusion, I've got to see about whipping around back to the hospital on my day off to talk to the cancer physios, because my arm's no good. Left arm burning, tingling, sore, and that's been going on for a couple of weeks, so I've got to have a lymphedema assessment. Now, only maybe at the most 5%, 3% to 5% of people that had 4 lymph nodes removed, called a sentinel node biopsy, get lymphedema. So you would think surely not. But only 1% of people the age I was got breast cancer. Only 1% of people my age got skin cancer, but I did. 0.001 got 7 skin cancers by the age of 40, basal cells, but I did. And let's see what else while we're playing numbers. 0.7% of people have the amount of perfectly good embryos, not implant, in IVF. Ambrose is lucky number 8. So that's a good news story right there. Only 2% of people have their gallbladder removed at age 22. Me. And I could go on, I'm sure. But, oh yes, one more. After my bariatric surgery, I had an absolutely horrendous Peterson's hernia, and the odds of that happening are about 3% for my particular surgery, and of course it happened to me. So what do you think, folks, is the chance that I will have lymphedema after they test my little arm or go through weeks of testing? I don't know. I should ask Chatty. In the context of all of that, what is the chance that my appendix will explode today? Far out. Alright, let's get on with it. And since I'm doubling down on this whinge fest, I have to load up, absolutely load up on water before everyone. All these things, everyone's trying to get into my veins, and I've got no veins. Tiny little veins. They usually have to do a hand take. All the more reason why it's problematic is you can't do needles or blood pressure on my left arm ever since the cancer, which is pain, because my little vein in my hand, my little geyser, oh faithful, was the one. But it's not all doom and gloom, because having lost that much weight, they actually are able to get into the cubital fossa on my other arm now. Sometimes. The last time I did this iron infusion at this clinic, it was a real bugger, and they couldn't get into it. So I got a water load. Plump up these veins, and then I'll have to go to the toilet. I remember many moons ago, a little psychology student was doing a prac, and I let her do an MMPI, I don't know, Minnesota something, multiphasic something personality test, and the result of that test was that I had subclinical but almost clinical level of hypochondriasis, which is a little bit of a, I guess it's a fixation on medical comorbidities. But I think all these statistics, folks, have proved why psychology is a bit of bullshit. I am perfectly justified to worry about my health and catastrophize, because it's always me. All right. I got to the GP, forgot the iron, had to go home and get it. I'm losing it.